Hi, David Liew here for Room Now from the Philly Convention Centre, ACR 22. Some more RA abstracts. In particular, I want to tell you about some data from the VA Rheumatoid Arthritis Registry, abstract 0889, and it specifically relates to the interaction between Adipokines and osteoporotic fractures. Adipokines, what are they? Well, they're hormones that relate to adipose tissue, to fat, and we've had a great appreciation over the last 10, 15 years about the importance of Adipokines. A lot of obesity-related damage and harm occurs because of Adipokines, and we know in particular they interact a lot with rheumatoid arthritis. We also know they interact with bone health, and that's what we saw here. So looking at this registry of rheumatoid arthritis patients, we saw a very clear correlation in terms of Adipokine presence and osteoporotic fractures. And so they looked at two different Adipokines, and if you had one, you had increased risk of osteoporotic fractures versus if you had none. If you had two, you had an even greater risk as well. So I think this really tells us a lot about osteoporosis management in our rheumatoid arthritis patients. And I think we don't often necessarily think about the pharmacology of it. We think about what drugs to give them, what drugs we shouldn't be giving them. But we really need to be thinking as well about the non-pharmacological management and really trying to think about how we manage fat, body composition in the context of managing the osteoporotic risk for our rheumatoid arthritis patients. For plenty more on RA and everything else at this conference, roomnow.com.